A New Jersey nurse is claiming that hospital staff misused medication in an effort to sedate psychiatric patients in order to lighten the workload. The nurse alleges that the night shift staff gave patients an antihistamine to make them sleepy. She said when she reported this to the hospital, they retaliated against her. Now she's suing. Joining us today via Skype to discuss, attorney and clinical psychologist Dr. Lisa Strohman. So is there a case here in suing the hospital?
There's a bunch of things here, but criminally and civilly, I think there's some legal issues here where you've got both the nurses in question that may have been going outside of their duty to protect and their ability to follow doctor's orders because they're the ones who get to decide this, and whether or not there's also some civil cases for those patients that may have been injured or damaged based on the fact that they were giving those medications.
But I do want to clarify for everyone watching, we're talking here about an antihistamine, diphenhydramine, which is in pretty much the majority of over-the-counter medicines. It's not like they're going in giving Xanax or high-powered benzodiazepines. And I wanted to get your take on that because I don't know the details, but sometimes I like to believe that something is not sinister, that actually maybe the goal here was to improve the patient experience, and maybe there was in medicine what we call a PRN order, an as-needed order, because as doctors, we often write these orders where, whether it's something like acetaminophen or ibuprofen or quite frankly, diphenhydramine, which is this antihistamine that's over the counter, we'll have standing orders in place so that if a nurse feels a patient needs one of these, because you don't typically, I hate to say this, but you don't typically call a doctor at midnight and say, hey, doc, is it okay if I give diphenhydramine?
If a doctor's order has a PRN or there's anything in the chart that states that the nurse can do that, then that's the legal crux here of whether or not they were able to do that without that order.
And Dr. Lisa, some of the other issues here is that it's alleged that these other nurses were doing this repeatedly without documentation. So now if we're thinking about possible side effects with other medications that could be given on a psych unit, like Xanax, then there could be some consequences if you're not documenting it in the chart. And on top of that, this is essentially a whistleblower lawsuit. So in New Jersey, they have this Conscientious Employee Protection Act where basically she's saying, once I made this complaint, apparently I became a pain in the butt to people and they started to ostracize me, put me on a unit where I wasn't trained to work on a unit, and tried to terminate me as a result of me not being able to work on a unit for which I didn't have adequate training. So Dr. Lisa, what do you think about that aspect of things?
There is protection in place in all workplaces for workplace retaliation. And so in this situation, I think that the hospital actually is going to have an issue with the fact that they took a psychiatric trained nurse and then placed her into a pediatric ward, which is a totally different population, on whether or not they're putting her outside the scope of her expertise and whether or not it was due to the fact that they were trying to maybe punish her for whistleblowing. And that's where the facts of the case are going to become really important.
Do you know what the nurse in question is seeking?
So it appears that she's looking and claiming that it's a hostile work environment. So you have to look at kind of the legal charges in that situation. She's going to have to show that she's been damaged in her career. How is that going to impact her financially? And then one of the biggest ones that I think that people don't think about, and what I spent a lot of time in, was this intentional infliction of emotional distress. Right. Anytime when you make a choice, when you're inside of a lawsuit or a litigation, and the person has a psychological distress out of it, and there is an economic or some sort of disadvantage that occurs to them. So in this situation, putting her outside of her scope of practice, the fact that she's feeling incompetent, the fact that maybe she's getting glares at work or supervisors are treating her differently, that's a psychological damage. And in lawsuits, typically, those are the ones that are awarded at the highest level with the most money.
We did reach out to the hospital and they gave us the statement. We emphatically dispute this account made by a former employee, which has not been substantiated by the hospital and is now the subject of litigation. Monmouth Medical Center is committed to providing a safe environment for our patients, visitors, and staff, and this accusation will be proven to be false. And, you know, that I'm always now, when there's a lawsuit looking for a lot of money, I'm always like, all right, let's get the facts before we rush to judgment.